Hello everyone and welcome back to my channel. So today I thought I'd talk about sort of pre-nursing tips for you guys if you're considering doing nursing, or even if you've enrolled to courses and waiting to go to university to do nursing. I just thought I'd give you 10 top tips just to sort of prepare you, whether that's on placement or your academic degree, just sort of general tips I sort of went by or wish I knew before starting my nursing degree. So let's get into the video. So the first tip is to really plan and organise. And what I mean by this is not going into nursing just sort of thinking it's not going to be a hard degree, because honestly it is, and you have to sort of plan and organise everything, because you're on placement but you could be doing an assignment whilst you're on placement, you could be having other commitments, personal life, you need to have your own life as well. So it's just really important to plan your days using either a planner, a diary, something that you can keep track of on your phone, just anything to sort of plan your days. And when I was sort of planning my days, and at the moment I've got a lot, I've got placement whilst doing dissertation, so I get the most out of my days off by waking up early, and I think that's a real big thing for me. Some people are night owls, I'm not. I just associate like in the evening just with relaxing and going to sleep and stuff, and reading and watching things on Netflix and things, and I just get a buzz sort of out of waking up early and getting a lot of my work done then, and just treating it like, I'm trying to do this more, treat it like a work day. So finishing at 5 and 6 and just having the evening off, instead of, I used to work till like 8-9 o'clock and it just used to like get delirious and drag, and I wouldn't be motivated to keep going on. But I did used to work up till like 10 and then have like breaks and stuff, but I just wasn't getting much done. In the daylight hours I am so much more productive with what I'm doing, and it's so much more beneficial for me to plan and organise my days rather than my evenings, and just let my evenings be relaxed time, me time, and just switch off from work basically. It's also really important to prioritise what you're doing in this first, this is still the first tip, so prioritise what you're doing, what you need to get done first, what's less important, and do the little things that don't take much time first, because then you can focus on the big thing and not have any other things underlying what you actually need to get done. And also I write a to-do list every single day without fail, because I just feel like this helps me tick off what I need to do and doesn't let me get distracted, otherwise I'll be on my phone or whatever all day. Number 2 is to know the basics before you go out on clinical placement. So for me in first year, this was many months into my degree, I went out on actual clinical placement, because my first placement was community, so it obviously wasn't in a hospital. But when you go out into the hospital, don't not know the basics of nursing. So what I mean by the basics are observations, vital signs of a child, what a child's normal heart rate, blood pressure, rest rate should be, what like serious red flags there are for children and young people, so that's 0 to 18-year-olds. What you need to sort of know as the basics. You don't need to know a list of diagnoses or conditions or medications or treatments. You'll learn all that in time. Just, I'm talking about the basics of nursing, how to introduce yourself to patients and families, and also just like the basic equipment you'll be using on a daily. Get familiar with the ops machine on your first day. Just sort of knowing the basics, I would say, is a really essential part, and looking these up before you start your nursing degree is really helpful. There's so many videos out there on YouTube how to take out a vital signs assessment, or how to plot pews on a graph, on a pews chart, which is Paediatric Early Warning Signs chart, and yeah, so there's just so many videos on that. How to record a respirate, for example. I would say if you're not sure about anything, obviously NHS is a really good source to have a look on, and then also I would say Spotting the Sick Child website is a really good and helpful tool, and they have a lot of like e-learning assessments that you can complete on there, just normal observations and things. And then also Healthline if you're thinking about maybe like what if the blood pressure isn't in the normal range, or what if it's continuously high, and how to sort of what that might indicate. Healthline website is a really good one to check out. Don't worry, none of this is sponsored by them or anything, I'm just giving you some